it is my pleasure to welcome here Alessio Arleo, who is a postdoctoral researcher at Center for Visual Analysis, Analytics Science and Technology. Alessio did his PhD at University of Perugia, and today he will talk to us about visualization for the healthcare in the COVID-19 era and the current trends in the analysis of time-varying data. So I'm sure it will be a very exciting talk. Thank you for coming here, Alessio, and the floor is yours.
Thank you very much. Can you hear me? I think so. Closer? Better? Yeah, perhaps. So, hello, everyone, and thanks, by the way, for the nice introduction. And before I begin, I'd like to thank again the organizers, even if only one of them are here, but you will spread the word. It's an honor for me to be here and be able to share my perspective on this topic, along with other recognized professionals in this field. Also, coming to a PhD school, it's quite of a responsibility for the lecturer, because it's not here again to lecture you, but rather to inspire you. Some of you might be starting a new career path or new project. And I hope that today something will stay with you and somehow steer which are going to be your next steps in your career. Or just hopefully it will be an interesting thing. So I will tell you some interesting things to know. Anyway, let's get started. First, what we're going to talk about. First, I'll give you some information about me so you know why I'm here in the first place. Then I will introduce the topic of visualization in healthcare from a more historical perspective, give you some hints about the role of visual analytics in all of this, even if some of the things I'm going to talk to you about were already introduced in the previous talks. And then I will proceed in listing some of the most interesting trends in visual analytics for healthcare and the challenges that I could identify. So as you have just heard, I am a postdoc at the WIN, and since 2018, I graduated in 2014, and my main research interests are more tailored about visualization algorithms for networks, but also, and you can see some examples of work I've done during my PhD, and also after beginning my career in TU Wien as a postdoc, while moving to a more general approach to visualization, I still kept a strong network component, even if working on industry, healthcare, and finance as well. So now that you know me a little bit better, let's get started on what the actual content of the presentation, starting from some basic definitions, some of which I think they are extremely familiar to you. I think that you have seen the definition of information visualization a lot of time. And also, you know better that creating a successful visualization is a complex process because there are a lot of different factors that you have to consider and their interplays and how they play together in order to obtain a successful, engaging visualization. But this efficacy of course, creating a successful visualization is particularly effective when providing an idea or a description of a phenomenon. That's why the history between visualization and healthcare is quite long. There are some examples, some more famous than others. I think that this is one of the most famous. The John Snow cholera map of 1854 is one of the earliest examples of visualization applied to healthcare. This is a map of a suburb of London, and each black bar is a case of cholera. There was a cholera outbreak in this part of London, and thanks to this visualization, it was possible to find the source, which was just a polluted water pump in this area. You can see that the majority of the black lines are gathered around this area. But it's not the only examples. Just 4 years later, in 1858, this is the Florence Nightingale's rose diagram. Miss Nightingale was a nurse, And she worked during the Crimean War, and she created this visualization to show the governments and generals that soldiers were not dying because of the sword, but rather because of diseases. In fact, the black part, so all these are is a circular diagram that shows the deaths of soldiers by fighting and by other preventable diseases. So this was one of the earliest and cleanest examples of how visualization could be used to provide governments more data and information to take action and decision. Fast forward something like 150 years, in the early 2000s, thanks also to the more availability of personal computers, the first tools for physicians to explore electronic health records and compare them were developed. And while some of them, they don't look like they aged well, they were quite the deal at the time, because it allowed physicians, who most of were used to pen and paper, to explore data in a completely new way. But the title of my presentation is In the COVID-19 Era. What has changed in the last 2 years? What changed is that we were force-fed every day by the news, trends, charts, graphs in a lot of different ways, try to portray the evolution of the pandemic in some way. So as you have seen yesterday with the beautiful presentation by Bert and Prime, talking to the common folk, so to say, to the layman, it's not an easy task. And actually, how did it turn out in trying to show again this? How this visualization was actually portrayed to these people in such a critical moment? This is one of the examples I could find. This is a tweet from the New York Times that shows the evolution of the pandemic in America from the early 2020 to early 2022. Not all of them, or not all the visualization community like this actually. Why this circular arrangement? And how can you actually compare two time instants to each other? But this is so, a visualization expert might say that while creative, it's not that accurate or appropriate. And it's not only the only examples. We have pie charts, we have crowded and out of context visualizations. And you might be saying you found the worst examples possible and then use these here for a dramatic effect. And you would be right. However, these were actually used. I did not make this up. These were actually used to portray information to the people. Of course, most of these were probably made by journalists, but it's also true that many of the visualization approaches that we find in conferences and journals did not actually get to be used in let's say, in real cases. But we will go back to that later in the presentation. The reality is that creating visualization is hard. Data is hard. Finding tasks is difficult, and the people that have to use it typically are picky, and or you can't keep their attention for long. But let's try to break this down, and let's start from the data, which is the part that we can somehow measure and understand better and unambiguously. So data can be characterized in several ways. For example, by the dimensionality, the presence of time, the scale, but also the sampling and the presence of noise. Of course, this shows how complex the problem can get. Especially, let's focus from time. Let's focus on time, how the problem gets more complicated when time is involved. Thing is that humans do not have a sixth sense that can sense time like we do with other physical dimensions. And it has different ways of aggregations. It's just more a simple sequence of consecutive moments. Agner et al. Try to provide modeling of time, providing different abstractions and dimensions that could help trying to help the researchers find a direction in how and to identify the most relevant dimensions for the problem at hand. But it's not just time, it's also the speed of the changes, the how much the data changes, and of course, how big the data is. Information overload is and the term big data is something that also was abused way before the term machine learning was introduced and abused as well. And of course, dealing with big data the way visualization deals with big data needs to make some compromises, because we don't have space for the data that we have to show. If we mapped every pixel of our available screen real estate to one of each of these phenomena, we will not be able to show any of them. So we have to resort to compromises, aggregation, grouping, filtering, and so on. But this also has its own problems, because even if we have that many ways to aggregate data and make statistics out of them, as we have seen in the last presentation, so I won't be long on that, it's not enough on its own. So we need the human validation. So how can all of this can be factored together? All of these different aspects cannot be just translated in one simple image. We need something more interactive, and that is where visual analytics comes in. It's a complex process that puts together visualization and interaction, so the part we've seen at the beginning, the automated part that gets into the filtering, aggregating, and statistical analysis of the data, and most importantly, the human in the loop. Is the science of analytical reasoning facilitated by interactive visual interfaces. I won't get much into the theoretical details of this, but just to give you a more appropriate example, this model of the process was introduced by Keim, and you see that it's a feedback loop that starts with the data, then you see the automated part and the interactive part working together in order to build a model. And this model is continually refined thanks to the intervention of the user. And all of this becomes knowledge that gets back into the feedback loop. Of course, designing such systems is not an easy task. However, Miksch and Einer introduced this design methodology that focuses on three critical parts that has to be considered when designing such a visual analytics application. There is the data and the characteristics of the data that we will have to analyze, the users that will have to interact with the system, and what the system, of course, is expected to do. This is a very flexible approach that can be applied to a wide variety of applications in different domains. And that is what I want to say about visual analytics. So you understand how complex it can be, but at the same time, how rewarding its results can be at the same time. How can this be applied in healthcare? Which are examples of there are many, of course, but I would like to focus only on 4 of them, starting from the most timely one, but it's not meant to be a positive adjective in this case, to the ones I find the more hot at the moment from my perspective, of course. And there are COVID dashboards, of course, visualization of electronic records, visualization of diffusion processes, and dealing with and visualizing uncertainty. And I believe that this term has been, you heard this term quite a lot of time yesterday, and also today there is another presentation just about it. So let's start with this. This is probably the most notable example of COVID dashboards. It's the John Hopkins dashboard, and it has been somehow adapted by every country in the world to fit their own needs, especially when it was about showing the pandemic trends to the public. However, in its term and condition, it says that it's only for academic and educational purposes. This means that every other use is out of its intended purpose. And also the use of map-based visualization has also its own quirks that has to be considered. So again, as I said at the beginning, many of the visualizations we've seen in news and newspapers were done by journalists. So there is a paper named COVIS that tries to support data-driven journalism. The objective of this dashboard here is to gather together not only the information available about the COVID trends. You can see here all the new cases, deaths, and so on, typical statistics that you have on the pandemic. But also, this is coupled with an event view that tries to make some correlations between specific events and the trend of the pandemic. Not only that, it also includes a predictive model based on a curve fitting approach that tries to help the user in creating their own time slices and to better explore and make what-if analysis. Of course, then it's going to be the journalist task to find meaning to those time slices. In general, so in a very high-level way, the approach is the following. From an existing events database, this event visualization is created. Then this is coupled with the different line charts, and these used by the user in this case creates their own events and inspects how the trends change. Of course, this was published when the pandemic was at its beginning, so there was much more research about the predictive models. However, this also provides what is an example of a support tool so that the information given by journalists, it's a little bit more objective and less oriented to obtain one or more dramatic effects. Let's move to visualization and exploration of electronic health records. This is an extremely wide topic. It's a very broad topic, and there are a lot of papers that deal with this problem. There are, just to give you an idea of how big this is, there are 3 surveys that deal with in some way with the gathering and surveying the available literature on this topic. One of these, for example, is the one by Alexander Rin, which was the first that tried to compare the available literature, also based on the support for medical and clinical research. Shortly after, there was this other survey about visual analytics for public health, where the visual analytic solutions are classified by the employee techniques, and also the gaps in the current state of the art are identified. And finally, in 2021, this other paper, Visual Analytics for Electronic Health Records, was published, and it's a systematic review of 22 techniques which are used to identify the key dimensions for visual analytics solutions, to identify the design space of visual analytics solutions in this context. And also to try to find out which parts of this design space are the least or the most populated. So this should give you an idea how hard it can be to publish something new into this specific topic. And there is a lot of interest on the integration of machine learning and AI techniques to support physicians in exploring electronic health records, because don't forget that they are extremely, the data has some very complex characteristics. It can be sparse, it can be unreliable somehow, and of course, patients are a lot. So one of solutions that were presented, it's RetaiNVis. RetaiNVis, it's an approach that tries to make recurrent neural networks to more accessible to physicians, tries to open the black box somehow, and allows the physicians to identify cohorts of interesting patients, and of course, drill down to the individual ones and conduct what-if analysis. So here you have this point, this scatter plot that gathers each point is a patient. Of course, the physician can change the axis, the color, and the encoding, and the dimensions encoded in the dimension and the color of each of the points to their own liking. And then after a selection is made, all the cumulative characteristics are shown here. And then when a single patient is selected, a what-if analysis can be conducted in order to make new insights, hypotheses, and follow the progression of the patient recovery better. Other than exploring data and this kind of data, you've seen that comparison and the identification of similar cohorts of patients, it's also a very, very timely and important task. And in this paper, they augment this process with sequence modeling and trying to provide another automated method to somehow suggest physicians and interesting cohorts of patients and compare them. In fact, you can see that you can see a trend here, because we still have scatter plots that provides these families somehow of similar patients, and then the individual characteristics can be explored using the other views. For all the technical details, I of course refer you to the paper. Again, as I said, this is quite a complex. It's quite a complex field in which to make new breakthroughs, which is a little bit different when you come to the visualization of design of diffusion processes. What is a diffusion process? Well, it is if you have a network of people, a network of computers, a diffusion process is a process that starts from a subset of this population and somehow spreads to the others. The sources of this spread can be called the seeds. And it's immediately obvious how this simple abstraction can model a lot of the social dynamics and several other phenomena. And concerning visualization, it's mostly under-investigated, which means that there is a lot of space for new discoveries and new papers. I would like to suggest this categorization of the available visualization techniques in this topic. One is backward search, which means that we have data to reconstruct the there is a diffusion process ongoing, but we have the data to reconstruct this process backwards and identify the sources. Then we have the simulation part, when we have we have a known network of individuals, and we would like to know which could be the best seeds or the most vulnerable people. And so we need a way to simulate the dynamics of that specific community. And finally, we have the process reconstruction, which is something that lies kind of in between, because we have a community. We have a process ongoing, but we have fragmented information. And these papers in this category try to reconstruct missing information from the available metadata. It can also be augmented with artificial intelligence and machine learning just for this purpose. Let's start from the first category. This paper was presented in IEEE BAS 2020 and was nominated Best Paper Honorable Mention. And it's a tool to help physicians identify the sources of outbreaks of diseases in hospitals. Nosocomial diseases are extremely dangerous because they are caused typically by bacteria that are resident in hospitals and therefore can build tolerance to antibiotics and typical treatments. Therefore, it's crucial when an outbreak is detected to isolate all the people that are involved. It starts from the available information about the transfers of patients between wards. And these are used to create this graph here that somehow shows at a glance how many people share the same ward and so on. Then this information is overlapped with the available information about the infection. And in this way, it's possible to identify potential transmission events. All this is then translated into a timeline visualization. Of course, many optimizations to avoid overlaps and minimize crossing is done. But this is the final result. And you have that this patient here actually had a lot of other chances to transmit the disease to quite a lot of other patients. And this is the overall view. You have here a cumulative array of all the cases, a 2D node link visualization that shows at a glance, given the same patient we saw before, all the possible contacts it could have. In the middle and on the side, you have the two timeline visualizations that provide extra details that possibly help identifying the sources of this outbreak. Moving on to the second category, to give you a, of course, when you have to simulate something, we have to provide a more accurate model, and this is one of the most used. So you can model a social network on which a diffusion process will happen, like a weighted graph, and each weight can represent the influence probability of a node over each other. So this means that this green fish here has a very low chance of influencing this other fish, while on the other hand, this red fish has a higher probability of influencing this fish here. However, at the same time, these are probabilities, meaning that each realization of a diffusion process is different. It's a stochastic process. So you can immediately see that we can't just make one simulation. We have to make many. And at that point, how can you visualize the results of a Monte Carlo simulation of a data structure this complex? This is related to the influence maximization problem, that is identifying, given a network representing a community of individuals, which are the best seeds, or in other words, the people that are most likely to influence or infect the highest number of people. Given the most common stochastic models that simulate the diffusion dynamics, it's an NP-hard problem. Therefore, with my group, we try to address this problem using visual analytics. And we came up with influence maximization with visual analytics, which is a visual analytics tool that enables the simulation of diffusion processes on several different algorithms. And the analyst can not only assess the quality of the seed set in terms of spread, but can also obtain guided and suggestions using a simple logic on how to improve the spread and test quickly the new set in a new simulation. This is the vision analytics system that we propose. We have a social network or a network representing this community of individuals as a medium where this process happens, which is synthesized using a matrix in this side. Then all these different areas represent a different simulation with potentially a different seed set. The user selects an area. Of course, these are like an overview of all the process. Of course, the red there, allow me to say that the cell, the more infection happens, also compared to the density of each cell. And of course, and the user can identify specific areas which can inspect directly. There is in this animation, you can see the system at work. Of course, it's all interactive with linked views. And the user can travel in time and see how the process goes on. Now we have a problem to solve, though. As is a stochastic process, this means that we try to identify the main paths, but this means that there are paths that have been used more often and paths that have been used less often. This is a type of uncertainty. This is a close-up. You see that some of them are more relevant, like the blue ones are the seeds, and all the other nodes are either colored in different shades of purple and edges in different shades of orange. This is a very naive, let's say, way to convey the idea of an information that we are not sure of. The more evident ones are the ones that are the most, that have been the highest probability of becoming pathways for diffusion. But doesn't mean that the others cannot, just with a different probability. And uncertainty, again, it's a very big topic, but we'll see that in a minute. Then quickly going on the final category, there is this family of papers and approaches that tries to reconstruct what are called missing links. There's a lot of theoretical literature on the reconstruction of missing links, and this paper applies that to trying to the analysis of known contact networks. You can see, and this is it's a very good example. You see that we have different hotspots. So we are like, these blue edges are like known contacts between people, so that could have brought an infection. And we have these different hotspots that are connected that would be otherwise, isolated. So it would be no reason for, so how did the patient zero of that hotspot got infection? This process tries to do just that, tries to infer using the metadata and other methods, the you see the contacts in red, these edges in red are the reconstructed contacts, and give some meaning to the graph that you see above. Of course, this is just an estimation, which then has to be validated by the proper experts. Again, a reason why I found this whole topic of diffusion processes very interesting is because, again, it's under-investigated. So there is a lot of space for new ideas, and I found it extremely challenging when I first approached it. There is a lot of theory, but not much in terms of visualization. Moving on to the last trend I'd like to discuss is dealing with uncertainty. Uncertainty is considered to be one of the major challenges of visualization since probably 2014. And but still, it's not, when you design a visualization, uncertainty is not considered as one of the design fundamentals. How does uncertainty work? It's not just data being noisy. It's something more subtle, because it not only influences, so this is the visualization reference model. So you start from the raw data, you transform it somehow. From this transformed data, you create your own views and visual mappings, and then the users, through interaction, obtain insights and change the transformation and the views. Uncertainty not only affects the creation of views because data is uncertain, but also the user given this data can have malformed insights, some not so accurate insights that affect the whole process. So it's something that needs to be considered, especially in a critical domain like healthcare. This paper provides concepts and methods and applications of dealing with uncertainty in biological data visualization. And it focuses on the individual components of the visualization pipeline and rediscuss them with aspects that are relevant for handling and visualizing uncertainty. It provides a set of possible potential ways, so it categorizes these papers in how they dealt with visualization, starting from an explicit visualization of the distribution of the data, even if this takes a lot of space. Then you have the use of samples, but also summarizing the statistics with range plots, for example, and also, which are something I found quite interesting, with the use of glyphs. So this is a protein, so it's a 3D structure, which is translated to a 1D visualization, and these wiggly lines here show places where the data is uncertain and give an idea of the proportion, of these fluctuations. So it's a compact way to provide a very complex information. But again, you can still consider uncertainty as an additional information and provide and use it when, again, designing the overall your overall application. Again, uncertainty is a problem that spans a lot of pretty much every kind of visualization. And again, this is how we dealt with it. But of course, there's much left to work on and a lot that could be improved in this. And also the paper provides some recommendations on how to deal with visualization with uncertainty in the visualization of biological applications and medical data in our case. Specifically, being aware that data can be uncertain, and this can deeply affect the whole analysis process and the resulting insights. Again, I put the hot kind of mark to this topic as well, because despite being considered a main challenge of visualization as a whole, there still, this could really benefit from fresh ideas, and again, making sure that it needs to be considered as a certainty, not just a possibility to have uncertain and possibly noisy data. Uncertainty, of course, also affects imaging, and there are a lot of papers that deal with that. I just wanted to quickly show you this, and because this is not the only example of how this uncertainty has to be dealt with also when going to biomedical imaging. I would like to conclude with giving a quick overview of which are the current challenges in healthcare. Egner and Rind, in different moments, somehow synthesized this set of challenges. You see that even in 2022, uncertainty was already discussed. However, with the recent advancements, I think, and my group thinks, that this set has to be revisited. you see that this intertwining between patient condition and treatment process becomes knowledge-assisted visual analytics. There is guidance also, that is a pretty new topic that needs to be considered. And one other thing that I will tell you at the end. I don't need to convince you, I guess, that scale and complexity of time-oriented data is a hard problem. And despite all the efforts in trying to modeling it, still it provides significant challenges. And all of them are somehow inside. So this is like a formalization of the cooperation of the three aspects of visual analytics. But still, again, this can be a very, again, given all the different parts, it's still a functional visual analytics solution. It's more just the sum of its parts. And then we have this knowledge-assisted visual analytics. What is that? This is the visualization model by Van Wyck, which I think you should be very familiar with. We have the data that becomes a visualization, and through an image and the user perception, knowledge is created. The user then, through exploration and some kind of specification from the visualization, the user through this changes the visualization and the cycle continues. Knowledge-assisted visual analytics models the knowledge of the user and how this can be, and how this affects the whole process. You can still see into this scheme the original model, but you see here that the machine part and the human part have been divided clearly. You have the knowledge here, this key epsilon, which is the explicit knowledge, which means information that is encoded within the machine and that is used to update the visualization, and therefore also the data. But also you have this tacit knowledge, which means that it's the knowledge that is that the user it's own to the user, and it depends on the perception, you see. So every different user will create different amounts of tacit knowledge, which then will be transferred again into the machine somehow. So this provides a new kind of dimension. So how a prior knowledge and the knowledge created during the exploration process be included into the design of such applications. This actually was the formalization of a previous work where the cohort analysis of electronic health records included a way for users through interaction to collaborating with the machine into this automated analysis and into the generation of computer interpretable guidelines for the treatment of the patients. So using the knowledge of the user again to support the machine in the analysis, and then at the same time support the user again. Of course, data provenance is another major point, because we talked about uncertainty, but also the quality of the data is important. Data provenance, and this example of tool called MetricDoc does just that. It uses metrics of validity somehow that are defined in a way that allow the analyst to have a quick glance of the quality of the information and possibly provide means to cleanse it. Again, having good data at the beginning makes the whole analysis process much easier. And when it comes to healthcare data, since many people generate and manage that information, it of course can be very, very noisy and difficult to tackle. Getting back to our design triangle, how can we apply that to this specific context? The data, of course, are patient conditions and treatment processes. that users are physicians, clinical researchers, patients, etc., all of them with widely varying levels of digital literacy, so the ability of interacting with automated systems. And of course, each one of them will have different goals and tasks that need to be considered. Another major point when it comes to evaluating, when it comes to designing and writing papers about visualization in healthcare is how we evaluate the systems. We have this tool, this guideline, the nested model by Bunzner, that provides us all the threats and pitfalls in the validation of visualization design, which was later extended by Meyer, introducing blocks and guidelines within the original blocks. However, which are the best evaluation strategies? It depends, of course, on the task at hand. We can evaluate the error, the time, are we using benchmarks, data sets, and so on. We have heuristics, like the ones by Wall in visualization. And I would suggest there is, of course, a thriving research field in this. And of course, there are also workshops like Believe that explore different methods for evaluating and validating visualizations. Getting to the end, just the last two. The first one is guidance. Users can have a hard time getting through different visualizations, algorithms, and parameters for those visualizations. So how can we, as designers, help them make through this, let's say, mess? Allow me to say that. With guidance in visual analytics is a mixed process. So we mean that it's made like equally by the machine and the user, and tries to make the user get over the knowledge gap. The user wants to know something from the data. The data knows this information. The machine tries to bridge data and user, trying to anticipate its moves and its objective. You can see from this scheme that it's kind of for real a mixed initiative, because you have the user that conducts an exploration to find some information from the data, and the system reacts to these inputs, of course, and tries to give cues so that the user can continue and get to the objective. It's a pretty hot topic at the moment. There are a lot of papers that talk about the theory, and there are a lot of potential applications, especially into this context. We run, of course, what guidance to give. It's a problem depending on the specific context. But when to give it, it's a problem that we investigated, trying to understand from the facial features when the user needed help or guidance better. To conclude, we saw these first points before, and there was one that I left the best for last, and is replicability and reproducibility. Scientific papers often include inadequate detail to enable replication, and creating reproducible research definitely requires an extra effort. And when data privacy and all the concerns are involved, of course, this gets much, much harder. However, it's an effort that pays off the people who do it, because it's a way that proves in a way that rigorous, that the research process was done rigorously, and all the available information to replicate it are available. It supports disseminations, makes ideas travel faster, and it's cited more. So this is definitely something that could be considered when designing your evaluation and your research. And let me point you to this initiative that is a graphics replicability stamp, that it's just that, making sure that people that your ideas can get to people. And this should match and make the pair with the beginning of this presentation, when I said that our journalists that are making the visualization. Often because our ideas as researchers don't get to them. So in order to improve the possibilities of our research being used actually for the societal good, consider also research. So let's make the research for people again. Thank you very much for your attention.
Alessio, for your very nice talk. Are there any questions for Alessio? If not, then I start with one and give you some time to think about them. You were discussing a lot uncertainty and guidance a bit. These two are typically researched in terms of visualization for experts. How do you think they could be used to increase trust in visualization for public domain? Because they are not very often used for public visualizations and general public. And we have seen it in COVID era that there were a lot of charts, but very few of them actually incorporated this aspect. So what is your take on this?
So first of all, guidance is, again, quite of a new topic. All people talk about it, especially if, latest BioMedVis, for example, but it's such of a complex thing to make into practice that there is a kind of a lack of real-world examples. However, the potential that it has to make visualization accessible, it's great, because again, it tries to support, it's not help, but it's a kind of support that it's more subtle, tries to understand which are the typical sequence of actions. Let's make it, I know it's oversimplifying, but just to make it sure that I'm clear. And then tries to suggest the same sequence to people that might know about it. So yes, it's this actually would be, in my opinion, a great way to make research more, visualization research more democratic, especially because with the fact that everyone is talking about this information, this data, having the possibility of making their own decisions and their own takeaways from the information can also help stop spreading fake news and people that try to use data to their own benefits.
What about uncertainty?
Uncertainty, we saw that there are several different ways to tackle it. And also, depending on the people you have in front of you, you have to provide the idea that data is uncertain, but you also should provide that you know what you're looking for. Yeah, data is uncertain, but we can make some, you can draw conclusions from it. And that's why just showing that data is uncertain, that you have some curves of uncertainty, that you have some distributions, is not enough. Otherwise, one can say, yeah, but this one distribution is like that, so why the other is better? Or why this one is better or more realistic than the others? So again, as we've seen yesterday, getting from the experts to the masses, it's very, very hard. And again, it's not like I have a clear answer for that, but definitely it's the way to go. Because now that everybody can access information, we should provide also with tools so that this information will be accessed equally and reliably.
Okay, thank you for the answer. Any more questions? Yes.
Thanks, first and foremost, for the amazing talk. And you mentioned beforehand that in the COVID era, there was some quite not well-used interpretations of the data on infections and hospital entries and more. Well, if, for instance, this visualization task and effort succeeds indeed, I think there's also another point which may be very important in the future, and that would be acceptance of this new procedure. Because if, for instance, the Johns Hopkins visualization was intended for research indeed, I presume that some other states and organizations would have used that in the sense, okay, we have this already existent method, why not just reuse it? Because don't change a running system, right?
Just to make sure I understood your point, you're saying that another important thing that should be kept in mind is the ability of this research to penetrate, the the experts and so on. And that's actually a very good point. One of the questions that are always asked at presentations of new techniques, there was a paper at a workshop of visual analytics in healthcare that provided a way for physicians to create 3D models of organs. And one question was just that many physicians are not familiar with laptops. So how can you make them at ease with these new tools? This is actually a very good point. And what I believe is that the generation is changing, you know, from the eldest physicians are retiring, so that a new generation of physicians that are digital natives are coming in. So I believe that with these tools have the potential to be accepted into the community and use just that. That's a very sensible point, and I will completely agree with that.
Thanks for the answer.
Are there any more questions? If not, then let's thank Alessio once again. Thank you.
Thank you very much.